Thank you for tuning in to Amaris B podcast. I am Dr. Ivan Puah, and I founded Amaris B Clinic in 2004. I am an MOH accredited liposuction doctor and medical aesthetics doctor based in Singapore. I have been trained directly under Dr. Alfredo Hoyos and Dr. John Millard for basal liposuction, Dr. Pierre Fournier for liposculpture, fat grafting, and thread lift. Also by Dr. Delgado for dedicated surgical training in gynecomastia surgery in San Francisco. Gynecomastia, you can actually break that word into two parts. The first part is gyne, and the second part, we call it mastos. In fact, gyne means female and mastos mean breasts. So gynecomastia in short means feminization of a breast. And when it occurs in an adult male, usually it will affect the patient's confidence, how they see themselves, and sometimes even physical symptoms as well. There's actually three causes, we call it etiology for gynecomastia. The first is what we call physiological, second, drug-induced, and third, pathological. So as the name indicates, physiological usually means is due to some changes in your body's hormonal system, which could be normal, but however, it caused some overreaction, overstimulation of the breast tissue, leading to enlargement or what we call hypertrophy of breast tissue. The second etiology is drug-induced. So usually caused by consumption of either medicine or consumer drugs, such as hair loss medicine and many more. And one of the most common drug abuse cases are like androgenic steroids, growth hormones, marijuana. All these can stimulate abnormal gland tissue growth, leading to gynecomastia. Lastly is what we call pathological gynecomastia. It's usually caused by underlying organic disorders such as liver disorder, kidney disorder, hormonal disorder, cancers, and such. Okay, I would like to emphasize one point. Gynecomastia breasts does not look like a normal tone pecs. They don't. They look like enlarged, round, could be saggy, droopy breasts. Depending on the size and the grade of the gynecomastia, they could feel a little bit puffy around the areolar nipple areas, and you could feel hardened, soft, could be tender, puffy mount around or even extending beyond the areola. And beyond that, you may feel fat layers wrapping around it. For those with grade 3 or grade 4 gynecomastia, they may have associated loose skin, making it droopy or female-like breasts. So that's why it is a complex condition, complex anatomy consisting of glandular tissues, soft tissues, fats, loose skin, etc. So treating gynecomastia involves correcting all of this that affects the patients. By losing weight, by toning up your chest will not solve it. Fat loss treatment, fat freezing treatments, even exercise will not be able to address enlarged glands and the associating tissues surrounding it. So treatment is actually surgical for those that are affected by it. If it affects them, the symptoms lasting more than 1 or 2 years without any improvements, then yes, surgical treatment it will be recommended. And there are other associated symptoms such as pain, tenderness, sensitive around the nipple chest area. You could have rash, redness, or even the nipple discharge. So these are symptoms that indicates the severity and even the underlying etiology of the condition. Thank you for listening. I hope you enjoyed the podcast today. If you do have any questions, please feel free to send it to us. We'll be glad to answer all of them. See you again.